Hey friend! So I heard you wanted to learn about OT. Well, it's as simple as learning your ABCs. Assessments are specific tools used to gather information and make effective decisions to support therapy services. These assessments usually take place during the evaluation process. Barriers and facilitators are things that can support or inhibit your performance and engagement. They can be environmental, physical, social, etc. OTs will often use a client-centered approach where the client is placed at the center of their care and an active part of the therapeutic process. Domains are 5 aspects of OT that support client engagement. The 5 domains are occupations, contexts, performance patterns, performance skills, and client factors. Ecological models are framework representations that allow us to see how clients interact with their environment and how it will affect their performance and activities. Frames of reference are specific intervention activities. There are so many that can be used throughout OT practice. One of my professors told me, a model is how you view, and frame of reference is what you do. Changing an activity, making it easier or harder, is called grading, and modifying a task or the client's performance to increase participation is called adapting. OTs will use these things to make challenges just right. OTs will often look at the person as a whole, their mind, body, spirit, beliefs, participation, etc. OTs will often say that they treat the person rather than condition. This is called holistic care. Often, you will find OTs collaborating with other rehabilitation professionals, physicians, teachers, nurses, family members, caregivers, social workers, you name it, we work with them to provide quality care to clients. Clinical judgment is something that OTs have to use on a daily basis. They should be able to use clinical and professional reasoning to make decisions to provide quality care and safe care to patients. OTs are equipped with the knowledge to be general practitioners, but there are opportunities for certifications, fellowships, and specialties for practitioners to participate in and find the perfect place for them. L is for learning. OTs help clients learn and relearn how to complete daily tasks and activities or occupations by teaching new techniques. M is for mobility, but make it functional. As one of the ADLs, OTs will say it's defined as moving from one place to the other, such as moving from a bed to a chair, in and out of a car, or getting into a tub or shower. 1917 was the year that the U.S. War Department implemented reconstruction aids in military hospitals to help disabled soldiers. This would eventually turn into occupational therapy. Occupations are meaningful activities that people need or want to participate in on a daily basis. OTs will analyze occupations to see how well people are able to take care of themselves, and assessing occupation can help OTs build an effective treatment plan. P is for process. The OT process is made up of 3 parts: the evaluation, intervention, and outcomes. The OT process is an ongoing interaction during treatment. OTs will ask you a variety of questions to gather important information, things that are important to the client, and things that are meaningful to them. These things will often be used to navigate intervention planning and sometimes encourage participation in activities. OT services are meant to restore and maintain function by using specialized tools and techniques. This is how OTs play a role in rehabilitation services. SOAP notes are a method of documentation that allows OTs to report on client interactions. It stands for subjective, objective, assessment, and plan. Therapeutic use of self is something that practitioners will do to aid in the therapeutic process. This can mean using appropriate humor, being empathetic, building trust, and being encouraging or motivation to clients. U is for understanding. OTs will ask and answer questions to better understand the client and also provide descriptions of care to the client or their care partners, as well as members of the treatment team. V is for versatility. OTs can work in a variety of settings, from hospitals to rehab centers, schools, outpatient clinics, community settings, just to name a few. They can also find their way into policymaking. W is for well-being. Well-being is in the definition of OT, but it also means a state of being healthy and happy. The goal of OT is to get the client to be able to take care of themselves in the most effective way possible, or to reach a state of well-being. As previously stated, OTs were started as reconstruction aides in military hospitals, and they have made strides in so many areas, from healthcare to community health to policymaking. OT is truly a small but mighty profession. So many people can benefit from OT, whether it's you or your loved ones, whether you're recovering from surgery, experiencing an illness, or returning to the community. OT can benefit you. Z is for amazing. I know it's a little far off, but OT is such a rewarding career, and even as a student, I have already been able to experience the opportunities that OT has to offer and witness how great this profession really is. Well, friend, I hope this helped, and hopefully now you know what OT is.